Hi everyone, it's Nico Murillo here, and we're going to wait a couple of minutes to get started. Just bear with us a couple of seconds to let a few people join. We have some special guests today. I'm super excited to introduce them to you. Okay, one more minute to get started. We have two doctors on the line, and they are busy women, so we got to get going, and y'all can catch up later if not. So just a few more seconds, and I'm going to get started. Okay, everyone, thank you so much for joining me on this beautiful Saturday afternoon. My name is Nico Murillo, and I'm the Chair of Texans for Safe Access, and I'm so excited to introduce two speakers today, Dr. Olga and Dr. Darina. And I'm going to read their bios to you. I'm going to tell you all about them, but we're going to talk today about veteran issues, and most specifically PTSD and how medical cannabis may help that. So I'm going to read Dr. Olga's OB's bio. Dr. Olga is a native Houstonian, board-certified emergency physician, board-certified eligible lifestyle medicine coach, practicing cannabinologist, and a Texas state certified or registered compassionate use doctor. She works with patients across the United States. Dr. Olga believes cannabis is an important and promising medical plant and enjoys educating anyone who will listen. Dr. Olga is also on Texans for Safe Access Board as our physician educator and leads us in medical education. Okay, and we also have Dr. Darina Douchi, and Dr. Douchi is a Nebraska licensed pharmacist with 17 years of wide varieties of expertise in the field of pharmacy. She is also a retired major from the U.S. Army with nearly 9 years of service. She is a wealth of She is a wealth of knowledge in the field of clinical pharmacy, pain and psychiatric medicine, focusing on the Army Warrior Transition Unit soldiers. During her service, she endured a back injury that manifested into chronic pain, migraines, and a slew of ailments related to her back injuries like depression, insomnia, and anxiety, to mention a few. Knowing quickly how she could become dependent on opioids, given her chronic conditions and the combination of medications she was on, she refused the standard opioids as treatment option and became interested in the medical benefits of cannabis. So thank you, ladies, both for joining us. I'm going to bring on Dr. Olga and Dr. Darina. Hi, ladies. I got your mic on mute. There we go. Technical difficulties. So thank y'all so much. I'm going to remove our banners so y'all can see who we are talking to. Hi, ladies. How are you?
Good. And yourself?
Doing great. Dr. Olga, so good to see y'all. Healthy and well, staying healthy during COVID. So thank y'all so much for being here and taking time out of y'all's weekend to talk about this important topic. So many of you may know that last month was Military Sexual Awareness Month. That was the month of April, and May is Military Awareness Month. So we're going to spend this month talking about some veteran issues. And so I really wanted to just open it up and just say, veterans deal with a lot of issues when they return home from the service. And those manifest into different things. And so I just wanted to quickly give a description of what PTSD is, and then we'll move on. So PTSD is a condition that may last months or years, and it has triggers which can bring back memories of a trauma accompanied by an intense emotional and physical reaction. And some of these symptoms may include nightmares or unwanted memories, and avoidance of certain situations that bring back this memory to trauma, heightened reactions, anxiety, or depressed moods. And that comes from a large variety of experiences they have during their time in the service. So I wanted to open up the discussion to you, doctors. And, so PTSD, what type of symptoms do we see coming from PTSD when we're talking about veterans?
I'll
Dr.
go ahead and get started. So from my experience, when I used to deal with the Warrior Transition Unit patients, we see very commonly is the major depressive problems. Along with that, a lot of them tend to have also traumatic brain injuries that makes things even worse. So it's not just a one problem. It's usually a complex. It's a cluster of different problems. That's what makes it really difficult to treat this group of patients. Then on top of that, they start to develop this social phobia or panic attacks. They also tend to have problems with sleep disturbances, nightmares, and that puts them at the risk of developing the substance abuse because they want a relief and they don't feel like they get that proper relief from medications. So they start to think about what other medications are out there or substances. And then many, unfortunately, as many as 20 per day, 20 to 22 commit suicide because they can't and don't know how to cope with the situation of and the complexity of the PTSD.
Right. And so, Dr. Olga, whenever you're working with any type of patients that are coming in from panic attacks or anxiety, are these easily diagnosable as PTSD, or how do you address somebody that's coming in with an anxiety attack? How do you address those symptoms?
So, like Dr. Douchi was pointing out, the rudiments or the basis of any anxiety or social disorder, whether it's from PTSD or otherwise, we have to think about why the brain does not shut off the recurrence of that trauma, which eventually you'll react to. And so to address it, we generally in our clinics, we have to start with how to stop or extinct that repeat association. And so how do you break up the association with the stimulus or the recurrence of the trauma? And the basis of that process is the cannabinoid system or the endocannabinoid system. And so that's why we find that cannabis is very useful in these cases. And so what my experience is also with PTSD patients, both veterans and non-veterans. We start with addressing their potential cannabinoid deficiency or excess of the endocannabinoid. Generally, these patients are endocannabinoid deficient, meaning their own internal cannabinoids are not in high enough levels, and then we have to supplement that. In our clinics, since we're in Texas, we start primarily with CBD and the CB cannabinoids like CBG. And then we use up to the 0.3% by dry weight of THC by adding it in small amounts.
That's great. And so what are the traditional forms of medications for someone with PTSD, and do they work?
You want to take that one or you want me to take it? Sorry?
No, I was going to say you have experience as a pharmacist. Is this more?
Sure.
Yeah.
So usually, and what the VA practice guideline recommends initially, of course, the psychotherapy, which involves different modalities of different psychotherapy, which could include the CBT or, cognitive behavioral therapy or the eye movement, the EMDR, that's how they say it. And of course, with that, you have the typical medications like the benzodiazepines or antidepressants. The FDA recommends the SSRIs or SNRIs like the Zoloft and Prozac or Effexor, but their success seems to be questionable depending on the patient and their severity. Of course, the VA guidelines does not recommend you use antipsychotics like quetiapine or olanzapines and stuff like that. But sometimes because they have other comorbidities with that, you end up having to add, sleep aids or antipsychotics to control their OCD behaviors or their major depressive disorders. So you start to add on the olanzapine and the arapiprisols. And as you start to add medications like that, patients tend to have that downward spiral effect of multiple problems because those medications come with a lieu of side effects like effect on their sex life, or starts to affect their blood pressure, or starts to affect their sleep pattern, or even sometimes it makes their depression, might improve their anxiety, but it makes their depression worse, or makes them even apathetic where they have no feelings whatsoever. So you fix one thing, but you're ending up with another problem, usually what we end up seeing.
Wow. Wow, that's interesting. Okay, and so a lot of people would have the question, could cannabis help me not use as many of these pharmaceuticals and gain balance in my mental health? And I think that Dr. Olga, what you're saying is indeed yes, that a lot of these episodes, if you look at the endocannabinoid system and the deficiency of it, that if that's off balance, then typically the answer is that this may work for people that have PTSD. So is that's a consensus, correct? And then what are your feelings? Go ahead, Dr. Olga.
Oh, I'm sorry, guys. I think there's a lag over here where I am.
There
I'm
is.
in the mountains, so there's probably yeah.
That's okay.
I was saying absolutely. Again is what we're finding is that the endocannabinoid system is for some reason either deficient or thrown off. It's overstimulated and overused and ends up in a deficiency or some other mechanism that affects that cannabinoid system. And so it's not primarily about cannabis. It's about our endocannabinoid system, and therefore we're finding that replacements with a natural substance like cannabis is beneficial. So yeah, I would say absolutely, and it's more than anecdotal at this point.
And then what about like drug interactions? I know both of y'all have experience with that. Maybe both of y'all's perspective might be beneficial. Are there any type of drugs that that may have any interactions with cannabis, or how would people even start to incorporate that into like a CBD product into their daily medicine?
First and foremost, when it comes to cannabis, you really have to know your own body first, and you have to know your pharmacogenetic composition, because sometimes people use cannabis and they come to me and they're like, well, I used it, it really didn't help. I wasted, $100 and some on a bottle, and you're telling me it works, but it really didn't work. First of all, I would recommend people to do a genetic test where they can do an enzyme test that tests whether you do have those enzymes that actually break down the cannabis or not. Then the other thing is, what other medications are you taking? Sometimes what happens is that cannabis actually works on 30 plus different enzymes in your liver and so many other sites in the body. So just in the liver alone, to look at the superclass of enzymes that break down the majority of the drugs, which is called cytochrome 450, that one tends to metabolize the majority of the drugs. And cannabis tends to sometimes, depending on the dose, it's dose dependent. If you take it in small doses, you actually can induce those enzymes that break down the other drugs. So one have to be aware and let their doctors know that, hey, I'm taking this stuff. You might have to eventually adjust my medications. So if you're taking it at normal doses, you're actually boosting your system. It's not just boosting your brain activity and makes you a happier person. It's also improving the functions of your enzymes in your liver. And now they're going to have to increase your normal dose of certain medications. Now, if you take that high dose, the extreme high doses of cannabis, you can do the reverse, which you can actually block those enzymes. And then what that leaves you with is a higher concentration of your medications running around in your system and keeping you awake longer, for example, or causing major side effects to your heart, for example, if you're taking a heart medication.
Oh, wow. And Dr. Olga, did you have anything to add to that, or that?
Yeah, so Dr. Douchi is absolutely correct. Cannabis, so that includes hemp, which we refer CBD comes from that, and then includes full-blown marijuana. Both have cannabinoids that will affect the breakdown or usage of medications that you're taking. My patients ask me specific medications. The other thing is that it doesn't just affect enzymes, it can also increase sedation or sleepiness or drowsiness of your other medications. For example, if you're taking a benzodiazepine like Xanax and you want to use medical marijuana to kind of decrease your dose. When you first start, you may notice excessive drowsiness by taking those two medications together. Because of those interactions, you want to be really careful about doing taking on these measures on your own. It's always best to consult with a nurse practitioner, a certified pharmacist, or a medical doctor before you embark on doubling up on medications with cannabis.
Perfect, thank you. And so we talked about CBD now. Do veterans benefit from whole plant medicine, or what is y'all's opinion on that? Dr. Olga, you want to go first?
Absolutely. Nico, you know what I'm going to say. Whole plant, although not a perfect science, my patients absolutely benefit from whole plant. And the reason why is because we believe it's because of what we call the entourage effect. It may actually be because multiple cannabinoids are working together. It may not have a whole lot to do with terpenes, but we have found with our CBD formulations that the terpenes are also very helpful, as well as the flavonoids. So our patient population largely depends on whole plant, and it's presumably because of the entourage effect. For example, terpenes like limonene we give for patients that are suffering from mild depression. And we have research that shows that limonene energizes or increases mood. We also find that adding linalool to patients that have very severe anxiety and even forms of attention deficit helps to add the focusing effect. And then likewise, terpenes like caryophyllene, which we sometimes add to our CBD formulations, helps a lot with increasing the pain relieving effect of the hemp plant or the medical marijuana plant. So we absolutely believe in whole plant medicine.
Awesome. And do you also believe that more THC is needed in our medical cannabis bill here in Texas?
Absolutely. In Texas, we did, THC is a funny compound because people just always associate it with the psychoactive effect, and they call that a toxic effect. And I really hate that term because when you say psychoactive, people think, oh my God, it's turning you crazy. In reality, sugar is a psychoactive, right? Caffeine is a psychoactive. Anything that works on your brain is considered a psychoactive. It activates your synapses. It activates your brain or neurons in a certain way. So I hate that term because it just makes it sound like, oh my gosh, it's killing your brain. It is dose dependent, and its concentration is related to different ailments and how you treat different symptoms. Like Dr. Olga was mentioning, having the whole plant is phenomenal because some of the cannabinoids that they're looking into are the CBG and CBNs, which have great benefits in treating the anxiety and depression and sleep disorders. And especially if, for example, CBN is basically the aged form of THC. And for those that don't like that, sedative effect, I would call it sedative effect rather than a psychoactive effect of THC. That is also dose dependent. You can actually use THC to relieve your anxiety and help you fall asleep with just maybe 1 or 2 puffs during the day of like a full of the full plant component works best. You do 1 or 2 puffs, it relaxes you a lot, but you don't really get that high or you're like out of the space kind of feeling. It's none of that stuff. But comes the nighttime, you can boost that dose more to where it relaxes you a little bit further. Doesn't necessarily knocks you out, gives you that couch lock effect where you just numb. It just helps you fall asleep better. What's your experience, Dr. Olga?
My experience with the other CB cannabinoids is wonderful. We are actually exercising a lot more with playing with something called broad spectrum hemp or broad spectrum CBD. Broad spectrum meaning including other CB cannabinoids like CBN, CBG, CBDA, CBC in varying percentages along with CBD, and then a very tiny amount of THC depending on the individual. We also want to make sure that our clients and patients understand, and caregivers and the community at large, the different routes and the doses of THC are very important. When I say routes, I'm talking about inhaled, smoked, oral, topical, and suppositories, because we are finding very promising results with patients that inhale small amounts of THC with CBD to address the extinction response that you experience with PTSD. For people that are not familiar, patients that have PTSD have a very real issue or difficulty with getting rid of or extincting the triggered response to a remembered trauma or reliving a trauma from the tiniest triggers. And so inhaling medical marijuana or medical CBD before an anticipated trigger has been very successful at preventing the full-blown traumatic event. And so I want to stress that the varying doses of THC is very important, that all states open up that amount, because everybody's body is different, everyone's response is different, and so everyone is going to require different doses of THC. But also opening up the route of administration is very important, especially when we're talking about PTSD.
Yes, I agree with you 100%, Dr. Olga, is that we need different forms of medication. We need the THC cap to be lifted so patients can access real functional medicine, and we need different forms. Right now in Texas, with our high CBD bill, all we're allowed are oral medications, like an oral tincture, which is diluted in an oil base. And for many patients, it's just simply not strong enough, or they can't drink enough of the oil to get the levels that they need. So we really need to open up the program to additional forms of medications, to include smokables and edibles and more concentrated formulas that's going to work better for patients. So ladies, I wanted to quickly read what the VA's definition for PTSD is. And then I want to talk about some mental health balance, because I know we're running out of time. But did y'all want to add anything before I close up with y'all?
This is a great topic. I mean, we can talk about this for hours on, especially when it comes to PTSD and the different doses. I do want to let people remember that cannabinoids have this biphasic or bimodal response. Just because you're taking a small dose and you don't feel that high effect, that does not mean it's not working. Start with a small dose, and it actually have been proven that it will give you the better response. In low doses, it gives you it gives you that alertness and calming effect, versus if you go with a really high dose, that's when we start to see the opposite actually happen, especially if we're trying to treat anxiety or depression. When you actually have really high doses, especially of THC, you tend to put patients in that they become actually more panicky and they are irritated. So we always recommend go small doses, just taper your dose until you find that happy medium, and then stop. Don't push yourself. That just because you're not feeling sedated does not mean it's not effective, it's not working.
Perfect. Dr. Olga, anything else, Dr. Olga? Okay.
Dr. Douchi, absolutely. Yes, I say that all the time. Absolutely. Start low and wait. Be patient. Your body is a living thing. It is not a car part. Just because you put gas in it does not mean it will go when you say. You have to wait. So I absolutely agree with Dr. Douchi. Start low and wait.
Awesome. Well, so the VA describes PTSD as a psychological trauma, which in the judgment of the VA mental health professional resulted from a physical assault of sexual nature, or this is military sexual trauma. because this was last month. So this is a physical assault of sexual nature, battery of sexual nature, sexual harassment which occurred to the veteran who was serving on duty, active training, or inactive training. So that was MST from last month, and I do want to highlight that that is part of PTSD triggers, and military sexual trauma doesn't just happen. Most of us think it's women, but it happens to both men and women. And so there are a lot of issues: the night terrors, depression, anxiety, rage, insomnia, that is all encompassed in the symptoms of PTSD. And some things that we can do that are outside of cannabis medicine that will help with mental health balance. I like to mention those. Finding a community. We offer a great community for y'all to come to and to find hope. Crafting is a great way. Garden therapy, music, prayer and meditation. So those are some great things that you can do to maintain your mental health. Is there anything else that you would like to add, doctors, before we sign off? I think that's it. Dr. Darina, no?
We look at each other. I just want to say that I just want to add, in fairness, it's not just soldiers and it's not just those that suffer, a sexual assault or physical assault. It's actually, it got and became recognized because it was affecting soldiers so much more, but PTSD does affect the average individual and those that have lived just about any kind of trauma, and different people respond to it differently. And there is no shame and seeking help. And there's no shame of talking about it and approaching others that have survived different traumas and say, I need help. And cannabis is okay. We want to remove that stigma associated with cannabis, that it is to make you high. It is not to get you high. It's a treatment option and it's valid. And if you don't know, reach out to us, to myself. There's a great community of veterans that have used it and firsthand believers of its medical benefits.
Yes, I agree. And I'm going to add this banner to the bottom of our page. And I don't know if y'all can see that, but what it is, I'm going to add two numbers at the end of our event. One to Camp Hope. That's a veteran hotline. If you're feeling lost and you need help and hope from community, that is a great organization, as well as the National Suicide Hotline. Always reach out to your community whenever you need help. So thank you so much, doctors. And I'm going to sign off with y'all all now. PTSD is an issue that affects our veterans and our whole community, and we need to come together to make sure that we can bring this functional medicine to Texans and to help patients. So thank y'all so much for joining this conversation, and thank you, veterans, for your service. Y'all have a great weekend.